Mr. Speaker, thank you very much, and I especially thank Speaker of the House, John Boehner, for allowing the House GOP Doctors Caucus to have the leadership hour tonight on this historic day, October the 1st, the Obamacare exchange launch date. It's entirely fitting that the Speaker allowed our House GOP Doctors Caucus. This group, Mr. Speaker, is made up of medical doctors, made up of registered nurses, dentists, hospital administrators, psychologists, optometrists, with over, now get this, Mr. Speaker and my colleagues, with over 600 years of clinical experience. Who knows better in this chamber of 435 than these 21 men and women who have spent almost their entire professional lives before being elected to the House of Representatives in the healthcare sector. So here we are, October the 1st, Obamacare exchange launch date, and hearing about malfunctions nationwide. We have received warning signs for months now that Obamacare wasn't ready, my colleagues, for prime time. Now, with exchange malfunctions in more than 30 states on opening day, the best HHS can do is tweet, "I'm sorry." On top of that, after having years to prepare for this disastrous law, the President informed us that we could expect these glitches for months to come. Obamacare was a bad law when it was signed 3.5 years ago, and now that we know what's in it, I firmly believe it's even worse law today. Someone trying to receive coverage in the exchange right here in Washington, D.C. reported this today, Mr. Speaker. After waiting on hold for 3 hours and 43 minutes, I was finally able to speak to a representative who told me she could not help me find a health insurance plan or provide any plan pricing information because, and this is a quote, "the system is down and not currently working at this time," end quote. She recommended I call back in a few days. I guess $1.329 trillion in taxpayer funds no longer gets you a functional government takeover of health care. Mr. Speaker, how can the administration expect people to believe that the exchanges are ready and that this bill is ready for prime time with Americans facing this sort of experience today, October 1, the rollout day? Let me just take a moment and maybe play David Letterman. Top reasons why Obamacare's exchanges aren't ready for prime time, colleagues. Number one, your data isn't secure. Think about that. In the Obamacare exchanges, federal bureaucrats will have unprecedented access to your personal data. Think the navigators that were hired. They will have not only access to your health care data, but also to your financial data. And this raises a myriad of privacy questions, which are only further emboldened by the risk of human error. Recently, a Minnesota exchange employee accidentally leaked 2,400 Social Security numbers. Number two, no eligibility verification to enroll. No eligibility verification to enroll. The Obama administration announced this summer that it will allow individuals to self-attest that he or she meets income requirements to get a tax credit, a subsidy. Eligibility verification is not only required by the law, which the administration has chosen to ignore again, It ensures that aid reaches the most vulnerable Americans for whom it was intended. I recently voted for the No Subsidies Without Verification Act to correct, Mr. Speaker, this reckless policy. That bill that I voted for, it's not law yet because the majority leader in the Senate is putting it in file 13, where he puts every other bill that the Republican House passes. And I'm very pleased that the author of this bill, Representative Diane Black from Tennessee, a member of the House GOP Doctors Caucus, is with us tonight, and I'll be yielding time to her momentarily. Number 3, Mr. Speaker, software glitches. Across the nation, further implementation delays have been caused by several glitches in the health exchange software. One of these accounts even strikes at the heart of the law's coverage expansions, making it impossible to determine how much people need to pay for coverage. Number 4, system not prepared for small businesses. The Obama administration recently warned the small businesses, those companies that employ less than 50 people, sometimes maybe 10 or 15, that they won't yet be able to shop for health insurance for their employees through online exchanges, leaving them to rely on snail mail or faxes for at least another month. Number 5, plans advertised on the exchange, Mr. Speaker, are misleading. Early this month, it was reported that many insurers, including Florida Blue and Aetna, were concerned that information offered on the exchange sites were misleading and in some cases are not representative of plans that exist. Well, I could go on, but at this point I would like to yield to my colleague, the gentle lady from Tennessee and the author of that bill, and I know she wants to talk about that, Mr. Speaker, Representative Diane Black.